back to our channel. Have you ever walked out of the doctor's appointment and felt confused or frustrated? If so, stay tuned and we'll tell you the 5 things you need to know to make the most of your doctor's appointment. Welcome to Prescribed, Healing Our Community. I'm Dr. Elena, a family medicine doctor.
And I'm Dr. Natasha, a clinical pharmacist. So, oftentimes the pharmacy is the first stop after a doctor's visit. We always hear patients say how they're unsure what the doctor's instructions were or what they should be doing in regards to their health. Also in clinic, I see patients all the time tell the doctor or forget to tell the doctor about their most important medical concerns because they either forgot or they were nervous or intimidated. So here's what you need to know to make the most out of your doctor's visits. Number 1, bring your medication bottles. So this is obviously very near and dear to my heart, but it's very important, guys. We understand that sometimes when you bring them every time, there's not always enough of time to go through each one. But when I review a patient's medication bottles with them, it's very, very helpful in order for us to know exactly what you're taking, how you're taking it. Sometimes just having a list of medications with the name and the dose and saying, yeah, I take it how it's prescribed, doesn't really help me. Just because it's written down that way does not mean that's how you're taking it. So it's really helping us understand exactly what you're doing at home and make sure that we're on the same page, essentially.
And I'm not sure if you see it in your patients, but for mine, a lot of people say, I'm taking a blood pressure medication. But it's hard to know which medication is your blood pressure medication and which one is for your cholesterol. So bringing the bottles helps us and the patients understand which medications are for what problem, and to make sure they're taking it appropriately.
And especially if it was prescribed by another provider, right?
Exactly.
Then we really don't know what it was.
And number 2, listen carefully. During these appointments, we discuss a lot of information. Much of these terms are unfamiliar to people who aren't in healthcare, and even though we try to break things down into manageable chunks, it helps if you're listening carefully. You can take notes even if you need it.
So that brings us to our point number 3, ask questions. There are no stupid questions. We understand that healthcare is so confusing, so please ask. That's what we go to school for a long time. And we are here to help educate you so that you understand your health. So be confident talking to your provider. We understand it really can be intimidating. You're not used to all of the terminology, but at the end of the day, it's your health. So you need to know what's going on and you need to understand what choices the providers are making for you and whether or not that works for you, because you have a right to your health care. So questions to ask. What are some of the side effects of the medication that you're prescribing me? Now, side effects aren't always 100% guarantee, of course, but you should know what are the most common, what you should be looking out for, and what are the potential side effects that may occur. Also, what do I need to know about and prior to the procedure? So if you're getting a procedure, I think they should know, what's going on, where is this going to be happening at, what do they need to do to prepare the day before so that you feel comfortable walking in the day of that procedure. Also, what are some of the alternatives to the treatment or medication that you're trying to give me? So yes, if we, sometimes it really is kind of like, you need this is going to be detrimental to your health if you don't have it, but you always have a right to ask, okay, what if I don't do that? What if I don't want that? What are some alternatives to the treatment? You have every right to ask that, and we're used to being asked that.
So number 4, tell your provider any changes that have occurred since your last visit. Most people have different providers, whether you see your primary care doctor, a dermatologist, a heart doctor, a lung doctor, things like that. Oftentimes, your primary care doctor, whomever, may not know what has happened since your previous appointment, especially if your electronic medical records don't communicate with each other. So it's very important to tell your doctor if you've started or stopped any medication since your last appointment, and then especially if you've had an allergy or an adverse reaction to the medication that was prescribed, make sure you let us know so we can document that and we won't prescribe it in the future for you. Also, let us know if there are signs and symptoms from a medication you're currently taking. And it can be something little, such as a cough or a runny nose or maybe some fatigue, but it's important for us to know. There might be an alternative that might work better for you, and there's no need to suffer undue side effects.
But we will say that if it happens, call the doctor's office
Yes.
when it happens. You don't have to wait. Oh, my appointment's in 2 months. I'll tell them I stopped taking my blood pressure.
No need to
because,
suffer that long.
yeah, I had a cough or whatever. Call them when it happens so we can make plans accordingly so that you're not going without medication or you're not having that side effect for 2 months unnecessarily. So just communicate with us.
And then also, tell us any changes to your family, social history, or surgical history. So you may have a brother or a mother or a child that was diagnosed with some chronic condition that we need to know about. That way we know how to treat you appropriately. And also if you've had a surgery, say you had your gallbladder out or your appendix out, we can document that in your history as well. That way we're not looking for a gallbladder that's not there. And also if you started or stopped smoking or started or stopped drinking, things like that are very helpful to know when we're planning your care appropriately.
Right.
And then lastly, before leaving, make sure you clarify your treatment plan with your doctor. As I talked about earlier, we're going over a lot of information that may be confusing and can lead to misunderstanding when it comes to treatment plans. So it's important that your doctor or you can summarize to make sure you know the treatment plan accordingly. That way your doctor and you, or your pharmacist, your provider, I should say, are on the same page when it comes to your care.
Yes. And then ask them to write it down too, guys. So if they're not writing it down and you're confused about what has been said, ask them to write it down, ask them to go over it again. And then we also like to do the teach back method too, right? So,
absolutely.
So we're asking you, okay, what did we just go over? What did we tell you to do? So to make sure, that's where we catch a lot of hiccups and misunderstanding, and we can correct it on the spot instead of you going home and not understanding what happened.
But it's always okay to call us back.
Oh, yes, yes.
Also, before you go, make sure to schedule your follow-up appointments. Oftentimes your doctor will say, I'd like to see you in a month, or 3 months, or 6 months. Go ahead and schedule that appointment before you leave the office, because life happens. We often forget to follow up and we think, oh, a year from now, I was supposed to see that doctor I saw a year ago.
Yes.
So just do it before you leave, get it on your calendar, and that way it's already there. During this video, we discussed the 5 things you need to do the day of your doctor's appointment. Now I'll write you your prescription for health. Clarify your treatment plan with your provider prior to leaving the office, and be sure to call if you have any questions.
All right, so let's fill that prescription, shall we? So remember, we all have the right to understand what is going on with our health. Make sure you understand what happened in the visit. However, we're human. You go home, you forget. I certainly have done that myself. So call your provider's office, or if you have a form of secure messaging, online messaging, you can also call to clarify or write them to clarify things that way. But just do that on the spot, get that out of the way so you're not going months not understanding what you should be doing. Ultimately, you are in charge of your own health. So go to our website, and we put the link below to get our healthcare visit checklist that we customize for you and we mentioned in the last video. There you can write down some of those questions the day of your visit so that you're not forgetting anything, and you can write down the instructions that your provider gives you. And don't forget, subscribe to our YouTube channel, follow us on Instagram at Prescribed, and leave us some comments on some videos you would like to see in the future. Thanks for listening. Bye.